Hello, and welcome to this week's Ethical Dilemma in Science. We're going to take a look at lead pipes and the Flint Water Crisis and ask the question, are we quenching thirst or drinking poison? So, kind of taking a look at kind of humanity's need for water. And so basically we are kind of living organisms with lots and lots of water found within our body. We need the water for kind of the proper functioning of our body, keeping our cells alive, keeping us alive. And again, depending upon circumstances, an individual can survive about 3 days without water. But beyond that, they're going to dehydrate and die. And again, conditions can change. So, if a person is exerting themselves at a higher temperature, sweating a lot, they may be their body may be strained by kind of lack of water much faster than kind of the 3-day estimate. And so if we take a look at this, human beings need access to good quality drinkable water. And so we can take a look at this. Kind of historically, there's been a need for getting access to water. And so on this slide, we've got an example of a Roman aqueduct. This is one near the town of Nimes, France, which has been built to deliver water from a reservoir, kind of a location, about 31 miles away, but then deliver this water into the city where the population is living and needs access to it. And so the Roman aqueducts are very, very famous. They were built over a 500-year period, starting about 312 BCE and extending up to about 225 AD. And now, even though the Romans preferred to use underground pipes and more commonly did that, they did have these mechanisms, the aqueducts, for delivering water over a much longer distance, more hilly distance if we take a look at it here. If we take a look at these criteria for what is going on, the statistics going on for what's going on with access to water today, and so working with data from the World Health Organization and UNICEF, they published a report in 2019 based on data from 2017 indicating that about 785 million with an M, 785 million people did not have access to basic water services. Services. And included within that, and probably beyond that because it's a bigger number, about 884 million people did not have access to safe water to drink. And so in this case, we're taking a look at some images, kind of looking at different populations. So we've got a population from India. This looks like it's from about the 1800s. A more recent painting that I found online of African women catching water, so you've got the pail in here. Even going back to a Greek urn over here, a hydria, basically a water flask from about 500 BCE, which actually has Greek women painted along the side, kind of going out and collecting water. And so without access to kind of indoor plumbing, running water within the house, it's dependent upon individuals going out to the source of the water and bringing it to them. And that gives rise to the crisis for this week, this ethical dilemma in this week's discussion, taking a look at lead pipes and Flint. And so we're looking at a situation that developed over a period of time, about 2014. We'll look at the timeline on this in a couple minutes. But we're looking at the fact that the Flint water supply, Flint, Michigan, changed from Detroit water to receiving water from the Flint River. And in doing so, there were some concerns about it. It was a cost-saving mechanism, an impoverished city that was undergoing kind of state control, and they were looking at cost-cutting mechanisms. That change in the source of the water resulted in pretty dramatic changes in the lead content of the water that was delivered to these inner city populations. And so we're looking at a series of reports in 2016. Flint Water Switch was approved despite the Department of Environmental Quality health warnings a year earlier. We're looking at the fact that they, in this cost-cutting plan, basically ended up in a situation where a doctor reported that all of Flint's children needed to be treated for exposure to lead, or at least tested and then determined if they needed further treatment. Ultimately, this rose to the situation where many of the people involved with the decision making, government officials as well as contractors, were brought up on charges for the rollout of this plan, which resulted in kind of exposures to lead for this population, especially to the children that were kind of going through development of their nervous system, and are especially vulnerable to the characteristics and the properties of lead going in and affecting the body. And so we take a look at it. High levels of lead can be toxic, but low levels of lead can be very, very damaging. They can interfere with the normal functioning of the central and peripheral nervous system. Even presence of low levels of lead have been shown to be associated with learning disabilities and resulting in a measurable decrease in the IQ. And again, recognize there are problems with measuring IQ, but at least with the tools we have available, they're showing that there is a decrease in like mental processing, if we want to take a look at simply like that. Developmentally shorter stature, kind of impaired hearing, as well as impaired formation and functioning of the blood cells. So basically, not good. Lead is harmful to the body, and therefore, you don't want to get it into the body, especially the body of very vulnerable children. And so we take a look at this. How does this happen? What is going on, and kind of what is the science behind it? And so basically, regardless of the water supply going to an area, you're going to have a source of the water. This may be a river, maybe a lake, maybe kind of an underground aquifer that we tap into. But basically, you take that source of water. And in most public water systems, that water is going to go through a treatment plant where it may be filtered. It may, be processed in some way. Many regions will add chlorine to the water to, kill kind of microorganisms that would have the risk of causing diseases within the individuals. And then once it's been treated, that water is often going to be placed into a storage location. And so, in many cities, you'll take a look and you see these kind of elevated storage tanks with kind of a reservoir of water, kind of along the entire length, but kind of the height of the water is going to add pressure that is going to push that water then into a series of distribution supply pipes that are going to go out through this populated area, ultimately kind of running down up and down streets into individual service lines that are go into an individual's home. And so these people on a public water supply system are going to be hopefully receiving water that has been treated and assessed, evaluated for kind of the healthiness, make sure it doesn't have, kind of harmful materials, it doesn't have pathogens being present in it, and then that water then is supplied out to the population that's going to be using it. And so if we take a look at this, many of the supply systems, these lead supply pipes that were commonly used in public supply systems and the service lines that go to the houses were commonly lead pipes. And this was occurring up to the Clean Water Act amendment within 1986. And so we take a look at this. We've got an example here of a lead pipe from Ostia Antica. But it's probably a couple thousand years old now at this point. And so lead is a stable metal. It's easily malleable, and so you can shape it into shape it into a pipe in essence. And if we take a look at the symbol for lead is Pb, which comes from the Latin word plumbum, which corresponds to malleable metal, and that's where we're getting the term plumbing from, the modern term today. So lead pipes were recognized as contributing to lead poisoning as early as the 1800s within the United States, and even to the point within the 1920s, so roughly about 100 years ago, some cities and towns were prohibiting or restricting the use of lead pipes for the delivery of water. Still, there were lots of efforts by the lead industry to promote the advantages of these lead pipes over other materials, and we see that lead pipes remained as a preferred material for building these service lines upwards to about the 1980s. Now, if we take a look at this, what are some of the requirements that have been involved with making sure that we get, quality drinking water, not contaminated with pathogens, not contaminated with things that are going to be harmful. And so if we take a look at the lead-free drinking water requirements within the United States, it kind of started out in 1974 with the Safe Drinking Water Act, which established kind of standards for protecting the water from contaminants. And then this has been amended at a whole variety of times. The 1986 amendment, which I mentioned previously, prohibited the use of pipes that were not lead-free, and so basically said that you could use pipes, but they couldn't include more than 8% lead, with the idea that if you reduce the amount of lead present within the pipes, you would reduce the amount of lead that would get into the water supply. They also kind of recommended or required that the solder and the flux involved with kind of joining these lead pipes together couldn't have more than kind of a very, very small quantity of lead. I think it was 0.2% lead at that point. Now, it's important to recognize that they said you couldn't put new pipes in, but it didn't establish a mandate for removal of old pipes as long as the lead levels in the water that was flowing through them remained low. And now the criteria for low, the exact levels for low levels of lead within the water, has continued to be refined over a period of time. Looking at the regulations associated with this in the 1990s, we saw kind of the initial efforts at the lead and copper regulations that were kind of revised, and I'll get to that in a couple of minutes, in 2021. And then finally, not actually a requirement, but the Environmental Protection Agency, responding to scientific data, basically came out and said that there are no safe levels of lead exposure in 2012, again indicating that we have this problem with lead in the population, and we need to try to minimize this. So when we try to look at the levels of lead within the population, get caught up with my slides and my notes, there are a variety of sources of lead within the environment in these built-up areas, especially within the United States, but around the world as well. And so the primary sources of lead contamination come from a variety of sources. Lead was included in gasoline upwards to 1996 because lead helped the engines run better. And so you're able to get leaded gasoline for kind of an extended period of time, to roughly about 25 years ago. And lead remains present in the gasoline that is available for aircraft, racing cars, farm equipment, and some marine engines. So there still is some leaded fuel that it seems to be available. Lead was commonly included in paint. It was associated with faster drying times, better durability, and increased moisture resistance. But this basically resulted in lead dust, which kind of forms, in the paint. And as that paint, kind of breaks down, as paint will do over a period of time, it will break down and have lead kind of dust associated with it that could potentially be then inhaled by an individual and resulting in exposure there. Now, lead paint was banned in 1978, although many old houses will continue to have lead present within lead paint present within them. And then the final source of lead, primary source of lead within the population, is lead within the water supply, lead coming from these pipes. And so this is data kind of representing kind of the blood samples of over 1 million children younger than the age of 6 that were collected and analyzed by a national laboratory for the presence of lead and the concentration of lead within the blood. And what they were able to show in this diagram over here is that we are looking at kind of large populations kind of across the United States. And the numbers are small. We're looking at about 6% of the population has elevated levels of blood, higher than that in these darker regions, kind of through here in the Midwest, kind of going through kind of the lighter dark staining regions, also still have kind of elevated levels. And again, keep in mind that what the EPA said was that no level of lead is safe. And so we saw that, with the removal of lead from gasoline in the 90s, removal of it from the paint in the 1970s, we're able to see that the average level of blood within the blood, level lead within the blood, dropped from about 20 micrograms per deciliter, and the values don't really make that aren't that important, but it went from a value of about 20 down to about 4 within the 1990s, down to about 2 in the late 20 teens, so within the last couple of years. Keep in mind, again, the EPA has said that no level of lead is safe, but when we take a look at it, we can see that there are some regions within the country where we have high levels of lead within a population, elevated levels of lead within the population. And so what they did within this study is look at the characteristics where they would find these higher levels of lead being present. And so on this slide down here at the bottom, they're basically showing that these higher levels of lead, kind of on these regions over here, are going to be associated with lower income levels, lower socioeconomic status. And so that's important when we take a look at communities and individuals having the resources to be able to replace these lead pipes. It's going to be costly. And if you're looking at a poor population without the resources, how are they going to be able to kind of go through the expensive process of replacing these potentially harmful, not potentially harmful lead pipes associated with them? Other factors that were associated with the higher exposure to lead, individual children having higher levels of lead within their blood, included children that were on public insurance as opposed to private insurance plans, children living in pre-1950s housing. Again, keep in mind that these houses were likely painted with lead-based paint and likely have lead paint on their walls that is starting to erode away and contributing to lead dust. And it's also been found with higher levels of lead within these children in zip codes with predominantly black, non-Hispanic populations. And so overall, things have gotten better, but it hasn't gotten better equally and equitably across the United States. There's still these populations where they have these increased risks associated with lead exposure. And so if we take a look at this then, based on this requirement, the EPA is now requiring that states report the estimated number and cost of replacing lead service lines. And so in this kind of map over here on the left-hand side, it's showing lead service lines per state. We're looking at upwards, in this case, the red and the darker red is looking at almost 500,000 lead lines that need to be replaced in some of these states, again, associated with that upper Midwest region, which we saw was also associated with the elevated levels of elevated levels of lead within children's blood. And so this idea then is that as long as the water flowing through the lead pipes remains at a low level, and again, that low level is changed, that criteria has changed over a period of time, they don't need to take action. But if we end up in the situation where the lead starts to leach out of the pipe, gets into the drinking water, that's when they need to take action and do something, in essence. We're trying to figure out, the EPA is trying to figure out how long and how much it's going to cost to replace these service lines. And we're looking at, in November 2021, there was about $15 billion appropriated to fix these dangerous lead pipes. Now, keep in mind that that's $15 billion, billion with a B, and it's been estimated that it's going to cost much more than that, in a range of about $45 to $60 billion to fully replace that. And in many cases, that's just the public portion of that. In many cases, the public water supply owns the pipe up to the start of the property line, but that lead pipe continues down through the property line into the individual's house. And so we see a challenge in that the homeowner has to get permission for the water company or a contractor to come onto their land to replace the water line, and in most cases, the property owner has to pay for at least a portion of that cost. And as that previous study said, oftentimes these lead service pipes are in regions with lower socioeconomic resources, and therefore they often did not have the funds available to be able to invest in the replacement of these water lines. And so if we take a look at this, again, within the last year, we're looking at the Biden-Harris lead pipe and paint action plan that was announced in December 2021, corresponding to the revised lead and copper rule that also came out in December 2021, was this idea that we need to really take action to identify and kind of determine where are these risky lead service lines, and then implement better testing mechanisms to be able to determine where they are at risk of contaminating the water with lead, mandates testing of water supplies to schools and child care facilities, and it overall has a goal of a faster, more complete lead service line replacement going forward. Still, it's probably going to be a process that's going to be expensive and is going to take 10, 15 years if it gets the support and gets the resources to be able to move forward on this action. And so this gets back to the Flint Water Crisis. So what's going on there? In April 2014, we saw, it's been reported that the water supply for Flint was changed from the Detroit water system, which was a little bit more expensive, using their treatment plants, their delivery kind of process and mechanism to get the water diverted from Detroit, 100 miles or so, a little bit more than that. I think I haven't looked at a map recently, up to the area of Flint. And so as a cost-saving mechanism, they stopped paying for Detroit's water and started drawing water from the Flint River. Now, when they did that, very quickly, Flint residents started complaining that there were, the water was cloudy, it tasted funny, there were smells associated with it, and, lots of concerns about that. Within about a year and a half, a Flint pediatrician, Maura Hana Atish, published a report, kind of illustrated over here on the right, that indicated that there were elevated blood levels in children and that incidence had doubled since 2014. So very quickly, there was a recognition that something had changed, and that change had been the conversion to the Flint water supply. By early 2016, the city of Flint and the state of Michigan had been sued in an effort to secure safe drinking water for the Flint residents, and then try to maintain proper testing and treatment of the water, and has the goal of replacement of the lead pipes. And so this is an ongoing process in Flint. And so what's going on? And so if we take a look at what's present within most public water supply systems and the problem that occurred when they switched over to the Flint water supply, is that we've got these lead pipes. And these lead pipes are made of metal. That's what you'd expect. And then water flowing through the metal has the potential to cause erosion to occur. It has the possibility of, the water interacting with the metal atoms that are present within the pipe. And so what we see is that in many, if not most, of the public water supply systems, they're going to be treating the water in some way. In this case, they're treating it with a phosphate corrosion inhibitor. And this basically results in kind of a mineral layer that is going to be deposited here, this phosphate layer that's going to be deposited along the kind of inner surface of that pipe, that's going to protect the metal of the pipe from interaction with the water. Now, what happened in Flint is that the water that was drawn off of the Flint River, and there are lots of discussions about why it happened. I'm not going to go into that here, but it wasn't treated with that phosphate corrosion inhibitor. And so that protective covering that was present along the inside of the pipes basically eroded away. And in the process of eroding it away, it allowed the water to interact with the minerals and the metal ions, metal atoms within the pipe itself. And what that did basically is resulted in corrosion. And we can see that both in lead pipes and iron pipes. So lead pipes illustrated here interacting with oxygen within the water. So basically almost like rusting, oxidating, causing corrosion to occur. The same type of thing can occur here where iron corrosion starts to kind of come off, kind of discoloring the water. And so if you take a look at this in this newspaper account, or at least a website account of the corrosion, you can see kind of the inside of these lead pipes, and they look nasty. They look like, you've got all of this corrosion that is going to be occurring. And that corrosion represents kind of a breakdown of the metal that's present within the pipe. And in doing so, we're going to result in the lead in the pipes getting into the water and then potentially getting in to the water supply that is going to be drunk by individuals that are supplied by that. If we take a look at this, the very early action was to try to remove the lead from the drinking water. And so they provided filters. And so many cases, filters that went on the faucets, kind of similar to these kind of pitcher filters. You put kind of untreated water up here at the top. They've got a filter mechanism here. Through the force of gravity, the water flows through. Hopefully, the bad stuff is going to be trapped by the filter and not get into the region where you're going to have the drinking water. But please keep in mind that the correct filters are going to be very effective at taking out materials from this contaminated water, but they're not 100%. This is a Brita filter, and I'm not picking on Brita. I've got a Brita filter myself that I use. They say that they're capable of taking out 99% of the lead that's present within the water. That's great, but it doesn't eliminate 100%. And so if you have a lot of contamination within a water supply, there's going to be a risk that some of that is going to be able to get past the filter and get into the water that is being drunk by an individual. So filters work, they are great, but they don't cure everything. They're not a fix for everything. Another way in which they tried to kind of minimize the exposure for the Flint residents as they were trying to work through this process was to provide free bottled water. They actually sued to have the bottled water delivered to homes, especially of individuals that had difficulty getting to the water supply locations. You don't want to have to take a bus or public transportation to pick up a couple gallons of water. Gallon of water weighs about 7-8 pounds, and then drag that home with you. And so they were able to get water delivered to their homes, but that ended in 2018. It's advantageous to get bottled water that is not as contaminated as the public supply water, but keep in mind that the bottled water that we see everybody, many people drinking. I actually use a metal water bottle myself, so I refill it. But the bottled water only has to meet the standards of the Food and Drug Administration, and the standards are that of tap water. So they need to be free of contaminants. They need to, not have pathogens that are going to cause disease in it. But effectively, it could be the equivalent of tap water. And there are reports that at least some brands of bottled water is basically taking municipal tap water and bottling it and making it available. So it may not be that healthy alternative that many people feel that it is. And again, if you're going to be drinking bottled water, please look into this on your own. Figure out what is the quality of water that is you're purchasing, and does it have an advantage? The risk associated with the plastic in the bottle adding to the pollution and adding to the landfills. Maybe potential ethical dilemma for a future date. And so when we get to this situation, so that even though Flint has been testing their water for a number of years now, they've reported that it is clean, there's a lot of distrust. The government said that it was safe before. Why should we trust the government now? President Obama, in the last year that he was president, actually toured Flint to see what was going on there, and actually drank a glass of Flint water in an effort to encourage people to recognize it was safe, but at the same time urging that children needed to be tested for lead and that we needed to continue these mitigation efforts. And so again, lots of risks associated with the presence of lead. Hopefully it's getting better within Flint, but as we saw on those slides, taking a look at the presence of lead pipes around the country, there are 12 million lead supply pipes, supply lines across the United States. That's a lot of lead that needs to be dealt with. Now, if we get to the current situation, recording this in early April 2022, as of January 2022, Flint has met the lead water standard for 5 straight years, even though many of the Flint residents, probably with good reason, continue to be skeptical. They continue to distrust that. Flint Water, the lawsuit against the state, the city, the engineering firm that was managing it, as well as a hospital system, resolved the litigation against it and has entered a period of settlement. And so they basically have a $625 million settlement against individuals that were harmed by exposure to the lead from the change in that water supply. And they're actually going through the claims process right now. This will extend into the May 2022 period. And then finally, in February 2022 and continuing now through March and into the beginning of April, we're actually looking at a pretty prominent legal case. We're looking at a trial where they're going to, they're going to interview, or not interview, they're going to put the former governor of Michigan on the stage to find out what was his understanding about what's going on. They're going to basically kind of try to come up with kind of an explanation and determine the liability of the individuals that kind of opened the floodgates, opened the Flint water supply to the Flint River and didn't properly treat it, resulting in the corrosion, resulting in the leaching of lead into the water, and potentially poisoning lots and lots of people within Flint, Michigan. And so 2 articles I thought were especially relevant to what we're talking about here. An editorial from the American Medical Association journal JAMA, Journal of the American Medical Association. I'm going to repeat that. It's time to end lead poisoning in the United States. And then finally, an article, again, in JAMA Pediatrics that came out, I think, in 2018. This one's in 2021. This one's in 2018. Basically saying, is it time to really look at a social justice framework for lead policy? We're seeing huge disparities in the exposure to lead from pipes and other forms of lead contamination. Do we really need to, take an effort to go in and deal with this once and for all? And that gives rise to the ethical dilemma in science for this topic. And so, we've taken a look at the fact that lead pipes have been used since at least the Roman times, a little over 2,000 years ago. And we used them upwards in the United States until 1986. Still, as the slide showed, 12 million estimated lead service lines remain in service right now. And so, I go back to the myth of Damocles and the sword of Damocles. Damocles was a courtier, went up to the king, told the king he was so fortunate to have power and authority. And the king says, well, if you think it's, that great, why don't we switch places for a day? And so Damocles got to enjoy the fortune, but then he's sitting here and looks up, and then the sword of Damocles is hanging over them, basically a sword being held up by a single horse's hair, kind of right above his head, kind of representing the threat of harm and disaster that is faced by those in power. And so in this situation here, where we're taking a look at lead pipes are great. Well, they were great until we found out about them. But indoor plumbing is great. The delivery of good quality, safe water to homes is great. We don't have to go out and pick up water and bring it home in in flasks or in buckets, or even the metal, or I use a metal water bottle or the plastic water bottles you can get at stores. Is the continued use of lead pipes analogous to the sword of Damocles? It's providing a great convenience at a huge potential health risk. How do we manage the risks associated with the lead supply pipes in a community given limited resources, limited funds for infrastructure improvement? We saw $15 billion with a B approved in 2021, which is only about a third or a quarter of what's needed. How do we go through that process? What factors should be considered in establishing the priority for replacement of lead pipes? Previously, it's been communities that had the resources available, the public water supply system that had the resources available, that would have the funds to be able to go in and replace these pipes with hopefully something that is going to be safer. But as we saw, those communities that have less access to resources, communities that are traditionally lower socioeconomic status, often are not going to have the funds for the government to replace it, and they're not going to have the funds for the individuals to be able to go in and replace the lead water lines that are under their property lines. Again, keep in mind that the public water supply systems generally only are responsible for the pipes up to the start of the property line. And yet the lead pipe is present along the entire supply network, going all the way into many people's houses. And then finally, should lead pipe removal be considered a public health crisis? And should we be focused on doing this as a community action as opposed to a more sporadic or kind of case by case kind of replacement, as we've seen has been occurring throughout the last 20, 30, 40 years. So again, kind of think about this and interested in learning your thoughts on this. As always, I'll be posting some of the references that I found were especially helpful in this. So if you want some more information, that's going to be available as well as the REE's Social Justice Framework of Lead Policy and the Landrigan editorial taking a look at time to end lead poisoning in the United States. And then as I was putting all this together, and again, you can see the timeliness of this, Benton Harbor, Michigan, another city in Michigan that had problems with their lead service pipes, and then under a mandate from the new Michigan governor, and this is a report coming out in April 1st, 2022, she's given contractors until May 2023 to go in and replace the lead water service pipes in Benton Harbor. So again, another region, probably not as famous as what's occurred in Flint, but definitely facing the same problem. So it's not an isolated issue. It's not a one-time issue. This is going to continue to be a problem until we can go through and replace everything. So thank you for listening to this week's Ethical Dilemma in Science. Have a great week.